All right, today we're jumping into a field that, believe it or not, affects every single one of us. We're talking about bioethics, that hidden framework that shapes some of the toughest decisions in all of modern medicine.
Okay, so picture this. Someone you love is seriously ill. There's a treatment on the table, but it's a long shot, with a low chance of working and a high risk of causing a lot of pain. So who gets to make that final call? The patient? The doctor who understands the science? The family who knows them best?
And look, these aren't just some abstract thought experiments, right? These gut-wrenching situations happen every single day in hospitals all over the world. And they are the very reason that a field called bioethics even exists, to help us find our way through the moral maze of medicine. So what is bioethics exactly? Well, the best way to think about it is like a moral compass. In a world where technology is advancing like crazy and medical choices are getting more and more complicated, it gives us the framework to find our ethical true north. So, at its most basic level, bioethics is all about systematically looking at the moral side of medicine and life sciences. It examines our values, our conduct, and our choices when it comes to life itself. It's all about asking that big question. Just because we can do something in medicine, does that mean we should? And here's the cool part. Bioethicists don't just go with their gut. To make sense of all this complexity, they use a shared framework, a system built around 4 fundamental principles. You can think of them as the 4 key directions on that moral compass. So these 4 principles, they've basically become the pillars of all modern medical ethics. Now, they're not going to give you easy black and white answers, but what they do give you is a really powerful way to break down the problem. And here they are: autonomy, beneficence, non-maleficence, and justice. Yeah, just 4 words, but trust me, getting a handle on these is the key to unpacking almost any ethical dilemma you can think of. So let's dive into each one. All right, first up, autonomy. This one is huge. It basically puts the patient right at the center of their own story. It's all about respecting a person's right to call the shots for themselves. What this really means is that any adult who can make their own decisions has the absolute right to say yes or no to treatment based on their own values and their own understanding. This is the foundation for ideas like informed consent. Your right to get all the facts before making a choice. So really, when you're looking at any situation through the lens of autonomy, it all just boils down to one simple, powerful question. What does the patient want? Okay, so let's shift gears to our next 2 principles. And these 2 really zero in on the duties of the doctor, or any healthcare provider for that matter. They are beneficence and non-maleficence. I want you to think of these as 2 sides of the very same coin. On one side, you've got beneficence. That's the duty to actively do good, to take positive steps to help, like performing a surgery that saves someone's life. On the other side is non-maleficence, which is the duty to avoid doing harm. Basically, don't make things worse. So one is about helping, the other is about not hurting. And that second idea, non-maleficence, is perfectly captured by this classic Latin phrase from the Hippocratic tradition, primum non nocere, which means first, do no harm. It's such a crucial reminder that sometimes the most ethical thing a doctor can do is nothing at all, especially if the risks of a treatment are bigger than the potential benefits. All right, so for our final principle, justice, we're going to zoom way out. We're moving beyond that one-on-one doctor-patient relationship, and we're going to look at the bigger picture. How fair is the entire healthcare system? Justice in bioethics is really all about fairness on a massive scale. Who gets a life-saving transplant when there aren't enough organs to go around? How do we decide who gets a vaccine first during a pandemic? It forces us to ask really hard questions about equity, about access, and about how we treat everyone in society. And believe me, the scope here is just huge. The idea of justice gets applied to so many complex issues. Everything from who gets access to brand new drugs in clinical trials, to the fairness of laws around abortion and end-of-life care. It touches everything. Okay, but here's the thing. This is where it gets really tricky. Because, if this was just a simple checklist, life would be easy, right? The reality is that these principles, they often conflict. They pull us in totally different directions. I mean, what do you do when a patient's choice, their autonomy, to refuse a life-saving blood transfusion, for example, goes directly against the doctor's duty to do good? Or what if making a fair, a just distribution of a scarce resource means some people miss out? This tension, this conflict, that's where the real hard work of bioethics happens.
So let's wrap this all up in a neat little package. This chart right here gives you the 4 core questions. For autonomy, it's what does the patient want? For beneficence, what's in their best interest? For non-maleficence, will this action cause harm? And for justice, is this fair to everyone involved? These 4 questions, that's the compass you need to navigate the toughest choices in medicine.
And this brings us to one last thought, kind of looking to the future. As medicine just keeps advancing at this incredible pace, with things like artificial intelligence, genetic editing, all these amazing life-extending technologies, which one of these 4 principles do you think is going to be tested the most? Autonomy? Justice? The balancing act is about to get a whole lot more interesting.